Good morning. Thank you so much, Melissa, for that very generous and gracious introduction. I am so honored to have been invited to kick off this morning with you. I want to begin by saying thank you to each and every one of you. Thank you to the sponsors of this event. We're living in times that are difficult. We have to stay committed to achieving health equity. And you are doing that. Your presence here today demonstrates that commitment. It also demonstrates moral courage. And I applaud you for doing that, for staying the course when our motivations, our priorities, our agenda, and our concerns are subject to needless debate. Some people call it backlash. My daughter, who is a leader in her own right, Heather McGee, author of the book The Sum of Us, thank you, she says it's not backlash, it's deliberate sabotage. And, the next generation opens our eyes every day, and I said, you're absolutely right, Heather, that's what it is. But I say to you, we would not have that kind of strategic sabotage if we were not succeeding. When they want to ban books and deny humanity through legislation in the 21st century, it is a direct response to the success of our collective efforts. So please, give yourselves a hand for staying the course. Now, I'll be speaking with you briefly this morning, but I want to bring you some good news. I think that in these critical times of political, I guess we could call it debate, but it's pretty extreme. We need to hear some good news, right? And so my talk is brief, but I hope it leaves you inspired and more ready to do just what I said, to stay the course. Could I have the first slide, please? We often quote Dr. Martin Luther King. He is most recognized in this country for the famous speech during the March on Washington. But one of his quotes that really touches my heart is this one. And he reminds us that darkness cannot drive out darkness, only light can do that. Hatred cannot drive out hatred, only love can do that. We have to have a strategy. Now, could I have the next slide, please? My life has been a life of hard work, as the bio recommends or suggests. I have had a life of great privilege. My life has been a life of hard work, as the bio recommends or suggests. I have had a life of great privilege, and I am so honored to have been able to be at this for more than 5 decades. Now, I don't say that in front of every group, but seriously, I recommend to each of you, if you haven't read it, to read a wonderful book called The Slave's Cause. It is over 600 pages. It captures the 100-year journey of ending slavery in this country. But what is the real takeaway from this book is the fact that it was a multicultural, multiracial, multi-religious, gender-inclusive, nationally spread movement. And we aren't told that true narrative and that true story. But reading that book, and the other beautiful thing about that book, it centers the work of the enslaved and formerly enslaved people in bringing about the end of slavery. If you read that book, you'll be in a state of awe, and you'll realize that we don't need to be tired. We are standing on the shoulders of giants who worked over 100 years to succeed to end enslavement, to end the adherence to the false ideology of a hierarchy of human value that dispossessed indigenous people of their native lands, that undergirded racialized immigration policies, that put in place so much that is harmful. They did this and they succeeded. So even though our movement is well over 60 years old, we will succeed eventually. The good news that I want to bring you, in addition to what we've talked about so far, is the results of an annual poll that we do at my organization, which is the National Collaborative for Health Equity. Quite simply, we were tired of hearing the polling data amplify the divisive rhetoric that's associated with the political campaign. And my heart told me that there was a different narrative. There was a real pulse of the American people. And so we worked with a strong political polling firm. This year was our second annual poll, and we call it the Heart of America Survey. Now, I'll be happy to, we have probably shared, but we will share a link with you for the full results of this poll, but let me just summarize. Despite all the media hype about polarization and division, even though people recognize that we are being pushed to be divided, most people, 80% of the respondents, and this was a nationally representative, multiracial, multi-ethnic, multicultural, over-concentrated or representative in terms of communities of color, 80% of those surveyed want a leader who will unite rather than divide this country. 80% or more want the history of our nation's racial past to be taught in the schools. And perhaps most importantly, respondents want us to find new language, find a new way of addressing these complicated issues in ways that bring us together. Next slide, please. Our work in Truth, Racial Healing, and provides one of those new ways to talk about and engage folks in doing this vital work. The Truth, Racial Healing, and Transformation strategy has 5 pillars in the framework and 5 steps in the action. The 5 pillars are, first and perhaps foremost, narrative change. We know that our psyches, our brains really are wired to lean into stories. Most political candidates know that, which is why they have autobiographies written before they run, right? People want the story. So we have to make sure, if we're going to bring about and sustain long-term change, we have to make sure that the true, authentic stories and narratives of who we are and how we came to be who we are, that those stories are incorporated into the canon, that those stories are part of our reality. And that challenge is made, you might say, easier, but at the same time more challenging by this age of automated information technology. Now, I could do a whole different talk as to why I don't call it artificial intelligence. I think artificial intelligence exaggerates the power of this automated information, but that's a different conversation. But in this age of social media, we have new opportunities to change our narratives. We must, however, make sure that there is more democratization of these new platforms and that they are a vital part of our work to achieve health equity. The second pillar of TRHT is racial healing and relationship building. Now, let me be clear that racial healing is not a deficit frame. This amazing human body that we have literally creates itself from a single cell. Those cells differentiate, divide, and multiply to become 37 trillion cells. And each of those cells is a unit of intelligence. And it maintains balance and health and well-being if we don't suppress that response because we're in states of fear and stress. And so when we talk about healing, we're not saying something is terribly wrong. We are saying, let us remove the barriers to the natural functions and evolutionary processes that are our birthright. So healing is not a negative or deficit frame in this context. Racial healing, however, requires that we do what this country hasn't done, which is to face the truth of our past, and also to bring diverse people together so that we can share our stories and we can move beyond the stereotypes and the biases that have been created by old narratives and current narratives. We can move beyond those ideologies if we learn to see each other as human beings. If we learn to connect and to see ourselves within one another. And that's what racial healing is about. There are different methodologies and approaches to it. The one that I have designed builds in an understanding of emotional intelligence, and they deliberately, these circles, do not re-traumatize the participants. Rather, they affirm and appreciate and acknowledge and engage the participants so that we build the capacities for empathy and compassion. In addition to racial healing and relationship building, the framework engages communities in addressing the history, the historic and contemporary legacy of structural racism. We simply asked ourselves, how has this ideology of a hierarchy of human value been allowed to continue and to be sustained for all these centuries? And the three primary vehicles for doing that were separation, the law, the economy. Communities across this nation are using this framework, and if I could have the next slide, I'll give you a glimpse of the growth and the spread of this movement. This map reflects some of the work that is happening in this country, and we continue to update it. It reflects the more than 250 public health jurisdictions around this country who have declared racism to be a public health crisis. And we at the National Collaborative for Health Equity have partnered with the American Public Health Association and the De Beaumont Foundation and created a set of policy briefs that detail the policy and practices that align with the pillars of this framework. And we've created a community of practice with leaders from many of these jurisdictions. We have TRHT campus centers in over 70 universities and colleges around the country. And there they are doing the work of applying the framework and educating the next generation of leaders. We have local communities that have formed coalitions that are implementing the framework and retelling the authentic narrative of their communities. Congresswoman Barbara Lee and Senator Cory Booker introduced resolutions in the U.S. Congress to create a national TRHT commission. We have over 70 libraries that have engaged young people in reading stories, their Great Stories Club, that really reflects the lived experience and the actual voices of community leaders. And that's just some of the work. We've had over 200 co-sponsors, legislators, co-sponsors. We've had thousands of local celebrations of the National Day of Racial Healing. So I just wanted to let you know that you are, in your commitment to health equity, you are part of an ever-expanding movement to achieve racial and health equity. or as I like to say, to jettison the belief in a false hierarchy of human value. I'm a Star Trek fan. I'll age myself. And when they jettison something on Star Trek, it is gone. It is time for us to take this 17th, 18th, century idea of a taxonomy of humanity and jettison it and replace it with a felt understanding, an awe and a reverence for our true interconnectedness and interdependence as a human family. Now, I know this is a little, passionate and light and, some people say California-esque when I talk about love, but we're very pragmatic and practical too. And so the last couple of slides that I'm going to share with you, they speak to a wonderful hope data system that we've developed at the National Collaborative. We've been at this work of health equity for so many decades, as I said earlier, and we stand on the shoulders of giants. But too much of our effort has been in identifying the disparities and the inequities. I told myself about 20 years ago I would never stand before an audience and reiterate that list of disparities again. You know why? Because until we do the real work of ridding ourselves of the belief in a false ideology of humanity, we tend to take those disparities, we, speaking of the greater, and we add to our stereotypes. It's amazing, but the mind works that way, right? And so we knew we needed to create an approach to collecting data that turned that on its head. And so the HOPE data system has restated the indicators, restated, we don't talk about food insecurity, we talk about food security. We don't talk about poverty, we talk about a living wage, right? We don't talk about homelessness, we talk about access to quality housing. So we shifted the narrative, to where we are raising the expectations for success and real transformation. I was privileged to work with the Robert Wood Johnson Foundation. I'm still working with them to design and implement a commission for transforming public health data systems in this country. And that commission was informed by the TRHT framework as well. We really emphasize centering equity in our narratives. We emphasize community ownership of the data and authentic, trusting relationships with communities. And we also emphasize making our data address the legacy of structural racism. The HOPE data system is one example of this kind of approach to data. And as I draw to a close, I want to just model for you the way the HOPE data systems works so that you might, in fact, apply it in some of your deliberations over the next few days. First, the HOPE data, we have 27 indicators, and they're divided into 5 domains. And these are indicators from the CDC and other nationally verified sources and validated sources. But what's unique about HOPE is that it centers equity, number one. Number two, it is opportunity framed, and that's so important. Number three, we establish clear goals, what we call HOPE goals. So as soon as you bring up the subject, you immediately connect it to a vision for transformation. And then we have an applicable methodology where we actually create what's called a distance to goal strategy that is quantifiable, so that we don't just say that we want to have equal access to healthy housing. We say maybe 3,000 more people in this geographic area need to have access to healthy, affordable housing. And then we can hold our legislators and ourselves accountable in a quantitative way for achieving those goals. And that's what the HOPE distance to goal strategy is. Again, this resource is available to you on the National Collaborative for Health Equity website, and many communities around the country are using this strategy. It begins with shifting the narrative and using data that raises our expectations for transformation and success. Now, at the beginning of my talk, I illustrated the Truth, Racial Healing, and Transformation framework. That framework also has 5 key steps. The first is to create a vision for success. So much of our work for social change focuses on the problem, but the problem doesn't get us to the future. Our vision for the future gets us there. So the first step in applying TRHT is a palpable vision of how will we feel. What will our communities be like when we have truly eradicated the belief in a hierarchy of human value, and we have put in place the transformed policies and practices? The next step, after we create the clear, achievable, aspirational vision, is to do an analysis of where we are now. We call it a landscape analysis, but that analysis is done in relationship to the broader vision. And then the third step is what we call our stakeholder analysis, because we need the people at the table who can make things happen in our coalition. And then we establish our hope goal. We establish our aspirational but achievable goal that can be measured and tracked, and we can be held accountable for achieving it. And then we figure out how to sustain the effort. So those are the 5 steps of applying the TRHT framework. And I believe what I've shared with you this morning is really good news. Even though the media would have us think that we are a divided nation and we are going backwards, we are not going backwards. Our ancestors didn't give up, and we will not give up. We will achieve health equity. I used to say, maybe not in my lifetime, but the young people that I was working with said, Dr. Christopher, why do you say that? And I say, well, when you get to be my age, and they said, no, don't say that. And so they made their motto, in our lifetime. And I would suggest that you do the same. Commit to achieving health equity in our lifetime. Commit to honoring the hard work and perseverance of our ancestors. And most importantly, commit to respecting and having reverence for this tremendous gift that we have been given, the gift of life. Thank you. I was going to say, do I have time? Oh. Okay, all right. I've been told we have time for some questions. So who's going to be the first? Questions or comments? And you may need to use your out. Oh, you have a mic. Okay, all right. Now I know. Please identify yourself too.
Over here. So good morning.
Good morning.
I'm Shanta Chambers with Patient Advocate Foundation. So as you've noted, we see a lot of activities going on where efforts to address health equity are being repealed. We also have organizations like SHRM who have used phrases like the word equity is polarizing. So when you have these types of entities that are really forcing organizations to think differently about how they address health equity, what will be your recommendation to really help us fortify the commitment and really give folks the narrative to forge forward?
I think, and I appreciate the question, despite the rulings by the Supreme Courts and the deliberate sabotage legislations, the lived experiences of diverse communities is reflective of the truth. It is reflective of our reality. And so built into this recommended strategy is the ability to bring together and amplify the actual authentic lived experiences of communities. In other words, they may say you can't use this word or you can't frame it this way. I even heard in Atlanta, I think it's in Atlanta, no, it's actually in Michigan. The legislature there has banned the use of the word social determinants of health, right? But when we talk about social determinants of health, we're talking about the conditions and the lived experiences of diverse people. And so I think in this moment, we have to be very flexible in terms of our use of language and words, but stay the course in our work. And so in this approach, if we bring people together and we expand our critical mass of support for the work, we really emphasize calling people in, not calling people out, and really expanding our circles of engagement, which are based on trusted relationships. That's the real work. I remind us all the time that we live in a democracy, and so a critical mass is not enough. We need a supermajority. Let us pray that we end up with a supermajority. But it is really about staying the course, finding language that is honest and reflective, and expanding our circles of engagement. It's also not being surprised by the resistance to the progress that is being made. As I started the talk, yes, we are in a time when people are pushing back, but they're only pushing back because we're moving forward. So the bottom line is take heart, don't be stopped by their efforts. There are successful efforts happening all over this country, lawsuits, litigation, legislation to counter banning books. This is a vibrant movement, and there is pushback. I think the most important thing for us to do, which is why I tried to be as upbeat as I could in this talk, we cannot become depressed and paralyzed by the loudest voices, the noise. The truth of the matter is that noise is not reflective of the public will writ large, and we have to remember that. But thank you very much for the question. Do we have time for one more? Okay. Oh, where are we going? Oh.
Hi, my name is Qianqi Huang. I'm a breast cancer survivor and a patient advocate. So I'm very hopeful after hearing your presentation. I really appreciate your comment. Actually, I just came from a anti-racist research symposium hosted by Robert Wood Johnson Foundation. And I totally agree with you that I think that moving forward, we need to have the assets-based framework instead of deficit-based. Because in the past, most of the funders just fund like research project or work that's focusing on health disparities. Right. And my feeling is that we don't need more funding to document what we already know. We need funding to support the practice-based evidence, right? And just like you said, use the data that we know to uplift the community and then to give them the resources they need to flourish, to thrive.
Thank you, yep.
So my question is, the happening of COVID is a rude awakening for many people from the Asian community. And many times I feel like when we talk about health equity, Asian population were kind of like invisible or not looked at. And my question to you is that we know that there are very limited data about the Asian population. And how can we get how can we get people to think more about not just, the data that you see may not be the real data, right? You need to give it more context to really tell the true narrative. Yeah, go ahead.
Well, first of all, I want to offer my kudos and appreciation for your own journey. And I also want to appreciate the things that you said before getting to the question. I appreciate that validation and your perspective. The Robert Wood Johnson Foundation has decided to make a firm commitment to a broader embrace of this work, right? And I know they are doing very specific work on, because some of their staff are Asian Americans, and they have leadership within the foundation to really tackle this idea of disaggregated and contextualized data of your community. So there is change occurring. 10, 15 years ago, when I was with the Kellogg Foundation, we worked to fund the first special supplement of the American Public Health Association Journal, which gave disaggregated, detailed data around the context and complexity of the Asian American population. And so that has to happen. We now have the CDC on board to do more of that work. So yes, it's not enough, but there is actual work happening. And as you all know, the outcome of this election right now is probably the most consequential moment in terms of this work being continued at the institutional level. For the first time in the history of this country, every federal agency in this administration had to produce an equity action plan. That has never happened. That should be a headline in this country, but it's not, right? And so we're in a moment of unprecedented progress, which is what I alluded to in the content of this morning's talk. It is up to us to make sure that that progress continues. So again, I thank all of you for being here. I thank you for staying the course and being committed as a collective to our inevitable success of creating true health equity. Thank you very much.